I'll totally, I'll see you later though, okay?
Okay, yeah,
okay.
bye.
Bye.
Shoot, 911.
Hi Bianca, how are you feeling?
Okay.
You okay?
Yeah.
My name is Sasha. I'm the nurse. This is Allison. This is our new graduate shadowing me today.
Okay.
So I want to explain to you what happened.
Yeah.
You were in an acute hypotensive emergency, so your blood pressure was pretty low. It was 76/42. Do you understand what that means? Your brain and your heart weren't receiving enough blood or oxygen, so you fainted. Otherwise, went into syncope. So I want to explain to you why we administered the medicine that we did. The medicine was dopamine, and dopamine basically just helps to elevate your heart rate and help it return to a normal rhythm.
Okay.
So do you have any questions?
Yeah, should I be worried that it might do something else, like any weird side effects?
You might have some side effects. Some normal side effects include some chest pain, palpitations. You might feel a little shortness of breath. You might get a little nauseous, a little headache and dizziness, but that's about the extent of what you might feel. Okay? If you have any questions, please feel free to give us a call.
Okay.
Okay?
Alright. I guess I just push the button.
Yeah, just give us a little call. Just that little call button, and we'll come to your side as fast as you can. Okay? I hope you feel better.
Alright, thanks. See you guys later.
Nurse Sasha, I'm sorry, could you explain the mechanism of action for dopamine? I didn't really understand.
Of course. To give you a little overview, dopamine is a natural catecholamine and a neurotransmitter in some areas of the central nervous system. It's also used for a precursor to norepinephrine, and it's a cardiac stimulant, increasing the force of contractility and the heart rate. Dopamine also stimulates the A1 receptor to vasoconstrict blood vessels, which increases blood pressure.
Okay.
Does that help clear things up?
Yeah.
Good. You did really good today, Allison. Thank you.
Hi, Mrs. Russo. Hi, Bea. It's nice to see you again.
Oh, good to see you too.
Thanks for bringing her in.
Oh,
today.
anything for Mom.
So it looks like we're going to be going over the new prescription that Dr. McKee prescribed for you for your Alzheimer's. So, did you have any initial questions before we start?
No, just if you can just explain the medication and how it works, that would be amazing.
Sure. So, as you know, Alzheimer's is a disease of the brain. The cells in your brain, called neurons, they need a chemical called acetylcholine in order to be activated and allow you to think and function normally. And with Alzheimer's, the neurons in your brain have started to deteriorate, and so the acetylcholine that is sent there has nothing to activate.
Okay, so this is why Mom's been a little loopy and her speech doesn't make sense sometimes. Sorry, Mom.
Yeah, and unfortunately there's no cure to restore the neurons back to their original form. So this medication, donepezil, can't cure the disease, but it can help to slow its progression. And it will help improve your cognition and help prolong your independent function.
Okay, so I'm stuck with it.
Unfortunately, I'm sorry, Mrs. Russo.
Can you tell us how it works?
Sure. So usually when acetylcholine is released into the brain, down after a while by an enzyme called acetylcholinesterase, and then it's recycled to be used again. This medication, donepezil, stops this enzyme acetylcholinesterase from breaking down the acetylcholine so that a greater amount is available to activate whatever neurons are left in your brain.
So is it a pill or a...
It is a pill, so you'll be taking a 5 milligram tablet every day at bedtime. And it doesn't matter if you've eaten or not, you can still take it. After 4 to 6 weeks, we'll have you come back in and then we'll evaluate you for any signs of improvement, and then we'll see if you're having any side effects and if we need to increase the dose.
Okay. And what kind of side effects should we expect?
So if you look on the other side of this pamphlet, two of the most common side effects you might see are nausea and diarrhea. And then another thing you want to watch out for is possible fainting, because sometimes this medication can slow down your heart rate.
I take other stuff too, don't I?
Yes, you do. What about her other medications?
I did review your medication list, and since you're not taking any NSAIDs or any other prescriptions for like an overactive bladder or any psychiatric disorders, one other thing, do you have any heart rhythm problems?
No, she doesn't.
Okay, so in that case, it should be safe to take donepezil.
Okay.
If any of your medications change, just call us and let us know, okay?
Absolutely.
Did you two have any other questions?
Mom? Any other questions? No? Okay. Thank you so
Take
much.
care, Mrs. Russo.
Hi, Bianca.
Hi.
How are you doing today?
I'm doing alright.
You hanging in there?
Yeah,
Okay.
I am.
So I understand you're scheduled for a surgery tomorrow.
Yeah, I'm having rotator cuff surgery.
Okay. And how did you sustain that injury?
I had an incident with kickball. I kind of ate it as I was running.
Kickball.
Yeah.
Okay. Kids still play those nowadays, huh?
Yes, we do.
All right. Well, do you have any questions about the procedure?
Yeah, I'm a little bit concerned about the anesthesia part. I don't know what's going to be like, how
Okay.
that
That's
works.
completely natural. So we're going to begin by doing giving you anesthesia, and adjunct to that, we're going to give you a drug called vecuronium. Has anyone explained to you what vecuronium is for?
No.
Okay, so vecuronium, it's going to be given an adjunct to your anesthesia
Okay.
while you're under. It competes with your acetylcholine at the neuromuscular junction, and it acts by binding to your nicotinic receptors on your motor end plate. And so what this is responsible for normally is any voluntary muscle movement that you have. So we want to restrict that during the surgery process. And unlike depolarizing neuromuscular blockers, this is actually going to stimulate, or it does not stimulate the nicotinic receptor, but it inhibits depolarization. Okay? It creates a neuromuscular blockade, and it relaxes your skeletal muscle, causing a state of flaccid paralysis.
Okay.
Okay?
Any weird side effects that I can experience or expect?
Well, vecuronium causes temporary paralysis of your skeletal muscle, including respiratory muscles, and this can cause respiratory rest. So we're going to be monitoring you closely throughout the procedure and after, making sure we have artificial ventilation available for you, and we're going to continue to monitor your vitals through the administration of the drug and following withdrawal until you have complete muscle function is restored.
Okay.
Okay? Special precautions, we just want to make sure that you're adhering to the nothing by mouth right now, right?
Yeah,
Okay.
anything after 12, that's what the doctor
doctor
said.
said.
Anything after midnight, I can't eat or drink.
Okay. Do you have any questions for me?
I think that's it.
That's it for now?
Yeah,
Okay, and if you have any questions, be sure to ask, all right?
I will.
All right,
Thank
take
you.
care.
Code blue, room A. Code blue, room A. Dr. Mackey, anesthesia, paging.
Alright, has the patient been on hypo too?
Yes, doc. And I have a Talmudine and fentanyl are in.
Okay, everyone just slow down. We're gonna take things nice and easy.
Okay?
Sex, please.
Okay.
Sucks. Oh, frick. I don't remember that.
Oh, come on, Bianca. Sucks is succinylcholine. Sometimes it's too long for doctors to say when your patient is in respiratory distress and needs to be intubated. Okay, fine. Crash course. Succinylcholine is a short-acting, depolarizing neuromuscular blocker that is used in short procedures involving the need for muscle relaxation, like what you're doing right now, an endotracheal intubation, and in this case, for severe respiratory distress. So normally, in order for a muscle to maintain contraction, it must continually depolarize and repolarize. If it cannot repolarize, as in the state of succinylcholine use, the muscle will remain in a state of flaccid paralysis. In order for this to happen successfully, succinylcholine is given IV. And, like acetylcholine, it must first bind to nicotinic M receptors on the motor end plate to initiate depolarization. This depolarization causes a temporary muscle twitch or fasciculation. Then, instead of quickly separating from the receptors like acetylcholine does, SUX remains bound to the motor end plate receptors. This prevents repolarization, inducing a continued depolarized state, aka paralysis. So, This is a great drug in the event of an emergency such as yours. However, sucks can cause significant patient harm and thus carries a black box warning. Life-threatening adverse effects include cardiac arrest, cardiac dysrhythmia, hyperkalemia, malignant hyperthermia, rhabdoanaphylaxis, renal failure, pulmonary edema, and respiratory depression. Serious contraindications are personal or family history of malignant hyperthermia, and use in patients presenting with multiple traumas or major burns, because use with these types of injuries may result in severe hyperkalemia and possible cardiac arrest. Oh, and P.S., you're administering 16 milligrams IV of Sucks. Thanks, nursing school version of me. Sucks 16 milligrams in. Doc, I cannot see anything right now.
Yeah, I know. That's why I'm prescribing pilocarpine. Oop, gotta run. Looks like there's a head trauma down the way.
What?
Knock knock. Everything okay in here? Did the doctor prescribe your new meds?
What? No, you had to go fix a head trauma.
Oh, okay. Alrighty then. So what he prescribed is called pilocarpine. It's used to treat glaucoma, which is affecting your vision right now. It's a cholinergic drug that reduces the pressure so that it causes your blood vessels to dilate or open up, so it makes them bigger. So in glaucoma patients, it makes your pupils constrict and lowers the intraocular pressure, which is the pressure in your eye. And so that is good because this pressure is what damages the optic nerve, and so that's what makes it difficult for you to see. So it also removes any obstructions that may be present, so the aqueous humor, so the fluid in your eye, it can drain out, which also contributes to the lowered intraocular pressure.
Okay, so do I eat it? Because I'm like so hungry right now. Like, I'm really hungry right now.
Okay.
I'm just hungry.
No, you don't eat it. It's actually a solution. So you're going to put 1 drop in your eye every four times per day.
Okay.
Yeah.
Okay.
So one of the common side effects that you may experience is sweating. You also may have some eye irritation or pain. You can also get diarrhea, increased heart rate, and possibly a decrease in vision. But if any of these things happen, you definitely want to call us and let us know.
Okay. Okay, so I just take this and I go. And I put the drops in my eyes.
Yeah, you're all set. That should help.
And I can eat, right?
Yeah, you can go eat.
Okay.
Yeah.